Salma Wes, and I'll be talking to you about our graduation project, the evaluation of medication and errors of anticoagulants in Alexandria University hospitals and their degree of compliance with the recent guidelines. The aim of our study is to detect and classify anticoagulant-related medication errors according to the NCC-MERP index. The lack of information on the prevalence and types of these errors motivated us to shed the light on this topic. Proper awareness can make these errors preventable, thus decreasing morbidity and mortality rates. Anticoagulant drugs are considered high alert medications, which, if not prescribed properly, can cause thromboembolic events and bleeding. During our summer hospital training, we've noticed the lack of proper documenting system. All the documented profiles lack the necessary data for selecting proper dose and medication. So we decided to make a specific patient profiles for patients on anticoagulants. The patient profile includes patient demographics, medical, surgical, and family history, necessary laboratory data such as CBC and coagulation profile, assessment scores which are necessary to prevent VTE and avoid bleeding by classifying patients according to their risk of bleeding, such as Padua, CHADVASC2, Caprini, and Hasbled. Using multivariate analysis to investigate the relationship between the causative factors and the resulting error types, results showed 62% of the errors lied under category A in NCC-MERP, where the circumstances had the capacity to cause an error, followed by category D at 34%, where an error has occurred that needs monitoring to ensure that no harm has reached the patient, with the lowest percent at 4% was category E, where when harmful error has occurred that requires intervention. The major underlying causes of these errors were unorganized patient profile, insufficient monitoring, and the lack of assessment scores. Apparently, the most frequent errors were easily preventable, which led us to create an electronic database, a website that has a special patient profile for anticoagulant patients, specific monitoring parameters to help the doctors and clinical pharmacists, and an interactive comment section where patients can ask freely about their medical health and medication.